Hello, everyone. My name is Dr. Tyler Shiner. I have another lovely case to show you. A tooth that we saved on a gentleman that came to see us from out of town, was only in town for a short amount of time, had a broken tooth, big cavity. Anyway, we helped him out. Let's dive into this case for you. So here we have the tooth. Okay, this is a lower left molar. And what he's got here is a big cavity that started out in between the teeth right here. Great big cavity. This was probably an old filling that was done improperly, and there was leakage coming up around the filling, which caused more decay around the filling until the tooth was weak enough that it just fractured. And I can tell you that by looking at the other restorations that he has. They don't look like they were done properly. We didn't have time to go through and replace all of his restorations like I wanted to, but that's probably what started all of that. Okay, so a bad restoration on a very back tooth. This tooth is in the very back of the mouth, which means it has a lot of force applied to it. So these are normally the teeth that break down first, are these molars, particularly the ones further posterior in the mouth. Okay, but what we can see here, this is from the tongue side, the tongue's view here. But this is a large cavity right here, okay? And it's actually fractured and has a cavity underneath the gum line. So see these gums right here, see how red and inflamed this is. This means that has been a cavity with lots of bacteria there for a long time. That's why so much inflammation and redness in that area. And this cavity here, if you were to poke it with an explorer, blow air on it, any of that, it's very, very sensitive. This patient is having a lot of symptoms. He was very unhappy and needed treatment ASAP. Okay, so we got him in, we took a look at it, and we got him treated. Here the tooth is from the cheek side. Okay, not much going on here. It almost looks intact from this side. Okay, so we're mostly dealing with a cavity that's on the biting surface and on the tongue side. Okay, here's a radiograph of this same tooth. Now this is what I can tell you about these fillings. You can see that they weren't done very well in the first place. You can see that there is a little gap between the tooth and the filling. This represents an open space where there's starting to be bacteria go in there and form another cavity. So this tooth here probably looked like the others with the filling initially, but then it got decay or cavities around it and it weakened and it broke. But here we can see the cavity actually extends clear up into here on the radiograph. Okay, and then this is the nerve of the tooth right here. And so the cavity is clearly into the nerve of the tooth, which means bacteria are invading that area that's full of blood vessels and nerves, and that's what's causing all the pain. All right. Another thing that complicates this situation is here is the bone that's supporting the root of the tooth, and the cavity is extending into the bone here, very close to the bone. So this is a difficult situation that we have here where the cavity is so deep that it's invading this little area here that we need to work with. Okay, so just so you know that I'm not making this up, this area that is being invaded by the cavity is called biological width. Okay, that's a distance between the end of the restoration or the end of the enamel-ish area, okay, and the bone. There needs to be a band of tissue, as you can see here, that's above the bone, okay, below any restorations of the tooth or below the enamel or on the enamel here. But it's a ring that goes all the way around the tooth that seals the tooth or the bone and the root from the bacteria that want to get into that area. Okay, because our mouth is full of bacteria. Okay, so at the bottom of what's called the sulcus, this is a little moat around your tooth where you get popcorn and whatnot stuck in there. But below that, there's an intact ring of tissue all the way around that. And I can't just go and shove my filling or my crown down into that area, or else, you know, what will happen is you'll get long-term inflammation from bacteria not being properly kept out of this area. Okay, and a lot of inflammation, which will result in inflamed gums, pink and bleeding, or I'm sorry, purple, dark red bleeding gums, and you can have bone loss here. Okay, so as you can read over here, The biologic width acts as a natural seal protecting the tooth from infections and diseases. Okay, and it also has, normally it's about 2 millimeters in width, but that can vary. That's plus or minus a few millimeters. It can be down to like less than 1 millimeter or like 4 millimeters in some cases. Okay, so here we are. This is after the root canal was completed, and after we did a buildup here. Okay, my partner did this beautiful root canal, and then he did a beautiful crown lengthening surgery here, which allows for this little gap to be here, okay, between the bone and the crown. Here's where the crown starts, right here. Okay, we need that little space right there to form that protective ring all the way around the tooth, 360 degrees. And here we are on the back side. You can actually see the tissue that's coming down here, and it comes and attaches to the enamel. And then there's our crown margin right there. Here's the finished product. Again, this is looking from the tongue side, okay? This is looking from the tongue side of from the original view that we saw before. You can see this is the same day that the surgery was completed, and also the same day that we finished the crown. We do the crowns in-house with the CAD/CAM system, and we only put the crown on the same day. So this little bit of redness that you see here, that's just from being worked on and from the surgery of that day. And so, but that'll heal very quickly because we didn't invade the biologic width. We didn't violate any biologic principles or anything of that nature. So remember, this is what it looked like before. The gum starting to grow up and over, okay, the cavity right here, growing up and over that area and getting red and inflamed. You can see the redness and inflammation all around the tooth here, okay, from the bacteria that's been present in that cavity. So here you can see it, and it extends actually over onto this tooth and as well as this tooth with the cavity. And you don't want that. You don't want chronic inflammation or inflammation of any type in your body. That's not good. Okay, but you get further away from that and you can see here, look, this is pretty good tissue. He does need a cleaning. You see some plaque and accumulations on the teeth here. He does need a cleaning and have these polished off. And these are a little bit inflamed, but not nearly as inflamed as this area here is. And if we would have went ahead and just did the root canal and done the crown without doing that minor surgical procedure on the bone and the gums, these tissues would look like this forever, right? It would always look like that. It'd always be red, puffy, and inflamed. It would never heal properly at all, okay? And that would also decrease the longevity of the restoration with all that inflammation present, okay? So here we have our before and our after, okay? Before here, big cavity. We've looked at this a lot, but let's focus on this one here. Nice. This is our little crown that we made in office and how well we were able to cover the tooth and gave this tooth a new lease on life. This restoration we expect should last for a long, long time. Not to mention, this guy felt a ton better as soon as we completed this restoration for him. So anyway, thank you so much for watching my video and for letting me present the work that my partner and I do. We're very proud of it, and it's a lot of work. It's very difficult to do. And this gentleman that we fixed his tooth on, he felt so much better. So anyway, thank you so much, and we'll see you in the next video.